So always do your 10 rights. All right, so this first question, we're looking at, we're preparing to administer a prescribed maintenance dose of digoxin. So that's our case event. This patient has heart failure. So digoxin is a med that's commonly used for heart failure. So you're already thinking in your mind, what do I need to do? What is my action as a nurse? And I kind of pull answers in my mind, maybe even before I look at the option, so I don't get distracted. That increases your confidence that you know something about this drug. You know what you need to do before you give it. You know what things you're going to be checking for or evaluating for. And so the query here is, which action should the nurse take? So an action is a nursing intervention. An action is always going to be, usually 9 times out of 10, one of two things: keeping the, or it could be both, keeping the patient safe, or fixing a problem, or helping the patient. And a lot of times that fixing the problem or helping the patient may be assessing or trying to reduce a complication from happening. We want to reduce problems so we don't have to fix the problem, or we want to be able to assess and recognize a problem so we can intervene early. So I would keep all that in mind. So sometimes you're doing a little bit of both of those, but if they present a problem to you, then focus on trying to fix the problem. All right, and then as you go through each option, you want to focus on your process of elimination. So with A, what are we going to do with A?
Keep it.
Keep it. Someone said keep it. All right, you can chat it, you can write it, keep it. Yeah, okay, not a bad choice. Withhold, possibly withhold it. All right, so withhold the medication if the heart rate is above 100. Someone else said let it go. All right. So we really have to focus in on what this medication is doing when we're administering. What is the action of this drug? How is it going to affect the patient? Why are they getting it? And if you remember, with heart failure, patients in heart failure, they can't handle the volume of fluid that they have in their body. And yes, it will lower the heart rate. Very good. It lowers that heart rate. So if their heart rate is already above normal, that 60 to 100, then yeah, we don't want to not give it, because if it's above 100, we need to get it back down to normal, 60 to 100. So with heart failure, if they're pumping their heart against a lot of fluid, whatever volume of fluid is in their body, that heart rate may work harder and it may pump faster. So we need to slow it down. Very good. Makes the heart beat stronger. Very good. So we are going to get rid of this just because above 100 is abnormal. If you notice it's abnormal, um, give it doesn't really increase the heart rate. So that would be a key information to know. All right, how about option B? Should we teach our patient to eat foods low in potassium? Is that a good nursing action? All right, good. Let it go. Awesome. No, yeah, we want them to have enough potassium on board. Very good. All right, so we're not going to instruct them to eat foods. We're going to get rid of that. Hypokalemia, yes, can cause toxicity. It will increase the risk of toxicity, digoxin toxicity. Very good. So we're going to get rid of that one. All right, option C says measure the apical pulse, and are we going to check that rate for 30 seconds before we give the medicine? Is that a good nursing action? Get rid of it. Yeah, very good. Get rid of that one. 60 seconds. That's it. That's the key. So a lot of people may key in on that because we know it lowers heart rate, and I need to check their heart rate before I give it. And so they can trick you on time proximity. So you want to make note that a good testing strategy is look at those times that they're giving you: 2 hours, 3 hours, 30 minutes, 30 seconds, 60 seconds. If they're giving you a time proximity that really doesn't make sense, then get rid of it. So that's a good one to let go. And that we're left with one. So it has to be the answer. Even if we weren't really getting to that, what is that telling us? What is that option? What does that mean? Evaluate for nausea, vomiting, and anorexia.